Hi, everyone. Welcome to Leadership at the Forefront of COVID. I'm Dr. Ann Pendo, Senior Medical Director for Experience of Caring at Intermountain Healthcare. We took a short break for a few weeks while my husband and I went to California on a road trip, working remotely, taking long walks, and enjoying a little bit of time together. So I'm happy to be back with all of you today. And today my guest is Dr. Elliotte Hirshberg. She is an assistant professor of medicine and pediatrics at Intermountain Healthcare and the University of Utah, as well as a critical care physician and director of the ARDS Center of Excellence. I'm so excited to have you here today with me. Thanks, Ellie.
Thank you, Anne. Thanks for inviting me. I'm excited to talk with you.
Yeah, we'll have a nice conversation. So I usually like to start by talking about what your job was like before COVID, and then when COVID happened, what are the changes that you noticed, and how did your work change?
Our daily workload prior to COVID consisted of working in the intensive care unit and actually doing some research because I'm part of a research group. So typically, my job involved some travel outside of the state pretty frequently to national meetings and international meetings, as well as direct patient care and a lot of directive meetings about where we were headed for research and how we could sort of bridge the gap between clinical care and research. And I think the most notable thing for me in terms of how things changed with COVID is really all of the travel changed. The conferences got canceled. They've been sort of all either online or networking via phone or LinkedIn type meetings. In addition, because of the sheer numbers of COVID patients and the fact that it's rare for my specialty is actually pulmonary and critical care. And our specialty actually was one of the specialties that was sort of called to action. So our bedside clinical care needs went up rather tremendously. And I think the way that the critical care day-to-day patient care stuff changed with the visitor restrictions and just the demands on us both physically and intellectually really changed the nature of our job.
Yeah, I'm reflecting on the way our worlds intersected was around how to connect families who are with patients and their teams that are in the ICU with visitor restrictions, and then also thinking about how we take care of our teams. And so what are the things that were most relevant to you as you were working on those two pieces of important care during the time of the pandemic?
Well, I think part of what has kept me invigorated and engaged in my work, and a lot of my partners engaged in their work, is the fact that the beauty of critical care, which is also very difficult, is that we are sort of meeting people and caring for people and their whole family at a very critical moment in their loved one's life. And the ability to connect with them, to have a real conversation and connect them to important support resources is something that I think all of us really thrive on. And because of COVID and the concern of making sure that we actually contained the infectious nature of the disease, not having the families readily available was quite challenging, I think, for all of us. But it also provided a really unique perspective, which is how you and I somewhat connected in the beginning, in that despite that being a priority for all of us, oftentimes in a busy day, I come to work and there are 18 patients, 20 patients that I need to examine all of them, connect with their loved one, and figure out a clinical plan, as well as connect with all of the other teams that might be involved with that patient's care. And not having the person present was challenging, but it also created a space where we could think about how to make sure that we involved them in the conversations and made sure that we connected them with the subspecialists, which I think in the past I didn't necessarily see as my job.
Yeah. Well, I think just the sheer amount of work that was required from you day to day, what are the things that you did to take care of yourself?
Great question. It was quite challenging. My husband is also a physician. So in the beginning, I think really connecting with him and our two children and sort of asking, being clear about what all of our needs were. They really stepped up and helped with the homeschooling of our younger child, as well as making sure that we did family exercise together and enjoyed the outdoors. We're a big outdoor family, and so I tried to really put that at the forefront of my daily routine.
Good for you. I think that's a good reminder for all of us. So as you think about, one of the things I've most admired about you is your ability to see a problem and then step in and say, this needs to be fixed, rather than waiting for someone else to do it. Where does that come from in you? Because you've done it multiple times since I've known you.
I think I'm maybe just born with that gene defect. No, I think I grew up on the East Coast and with parents who really encouraged me to always probe, to ask why, and figure out the logical solution to a direction or a path. And I think that I kind of thrive on seeing a problem and figuring out a creative way around it.
Yeah, well, we've been so lucky to have you and that creative drive, that curiosity, helping solve problems. We're working together now on a family communication project, looking at our the journey of a patient through our healthcare system, from being greeted in the hospital at the entrance to the emergency department to inpatient care to ICU care. And one of the things that I've most appreciated is your willingness to say yes.
Well, thank you.
So I'd like to say thank you for that.
That may be my greatest downfall, too.
Yes. So how do you know when to say no to something?
I think that that's been one of the lifelong lessons I'm still struggling with. And one of the things actually that COVID, I think, has presented itself as a necessary demand on me is figuring out what I can say yes to and what I can say no to.
Yeah.
And so the things that give me passion and the things that give me joy are the things that I continue to say yes to.
Love it. Great reminder, again, for all of us. So in the last minute or so, what are the things that you've learned about yourself, besides how to say no and what to say yes to, about yourself personally and as a leader?
I think that the number one lesson is I really cherish, and I hope that I continue to transmit this, but I cherish leaders who lead by example. And in this environment, I really tried to set forth an example of how I wanted everybody who was listening to me to also treat their patients, treat their families, treat their colleagues. And I think in terms of things that I can keep working on, it's sort of the challenge of really recognizing my time management and how much I can actually accomplish, even if I do have passion for something.
Yeah. Well, I so appreciate you taking time out of your very busy schedule. I know earlier this week you worked all night. Yeah. And my guess is you were awake all night doing that.
Yes, I was.
So most appreciative of you for that. And let's come back together once we've got our family communication plan in place, and we can talk about what we've learned, what matters most to our patients, how we can help our caregivers be supported by the work that we're doing together. And with deep admiration, thanks for being here today.
Thank you so much.
I really appreciate it.
Thank you.
Thanks, everyone, for joining us on Leadership at the Forefront of COVID today. We'll look forward to seeing you next week. Take care. Bye-bye.